that's my table of contents. The association of CSD is cesarean scar defect, and the infertility, pathophysiology of infertility due to CSD and IVF outcome, and how to manage patients searching for a pregnancy. So, well, if you go through literature, you can find different definitions for this problem. CSD, cesarean niche, cesarean diverticulum, cesarean pouch, ismocele. So sometimes it's not easy to find all the documents, all the papers that have been published on this specific topic. But what is clear is that CSD may only be secondary to a previous cesarean section. And as Jack said, the risk for CSD is increasing with increasing number of previous cesarean sections. So in women with just one cesarean section, you have a great risk of CSD, as high as 40 to 60%. And for those patients with 3 cesarean sections, well, we are pretty sure she can have a cesarean scare defect. Jacques already said, we are facing here a problem which probably will be great and great in the future. Globally, the prevalence of cesarean section is 21%, but we have some estimation that in 2030, the rate of cesarean section will be as high as 29 or 30%. So we have to be ready to have a lot of women in our infertility clinic because of secondary infertility due to CSD. So let's try to answer to this question. Is cesarean section per se associated to reduced future fertility? The answer is yes, if we look at this very well-known meta-analysis, which concluded that the fertility is decreased by 10% after one previous cesarean section. And if we look at the pregnancy interval, so the time to pregnancy, it is longer for those women who had a previous cesarean section. And we have another interesting study which followed up 1 million women after a first live birth, and they found that women with a previous cesarean section, again, they had a small but significant reduction in the possibility of future fertility. What about CSD and IVF outcome? Well, first of all, we have here a nice article based on women with a previous cesarean section and undergoing in vitro fertilization. Authors found that 39 of those patients had a cesarean scar defect. So again, the prevalence of CSD was 40% in women with a previous cesarean section. And during ovarian stimulation, they found that 40% of those patients had some fluid into the uterus. And the patients with the fluid into the uterus during ovarian stimulation were patients with the larger niche, the larger CSD. What was the strategy of those clinicians was the so-called freeze-all strategy. So they preferred, of course, I will say, to freeze all the embryos and then to transfer back in successive cycles. Cesarean section seems to decrease the chance of live birth in IVF. This is the main conclusion by this Dutch group of authors who analyzed 1,300 women undergoing IVF. Again, more or less 30 to 40% of them had a previous cesarean section, and those women with a previous cesarean section, they had a lower live birth rate, which was 22% in comparison to, which was 16.9% in comparison to 22% in women with a previous vaginal delivery. Not all authors agree on this. We have here a recent meta-analysis by Amerigo Vitaliano, who analyzed 8 studies for a total of 10,000 women, and they concluded that cesarean section per se is not reducing the success rate in IVF, but if the CSD is there, if the patient is presenting a cesarean scare defect, then the odds ratio is 0.6 to have a success IVF. We have here a retrospective study on 2,500 IVF cycles in women with a previous cesarean section, and the primary outcome was live birth. When the niche was evident, the live birth was 18% compared to 31% in women without the niche. And what's interesting in this article is that authors found an increased risk for miscarriage in women with the niche. But they could not find any correlation between the dimension of the niche and the risk of miscarriage or the possibility of live birth. Different conclusion in this study, which has been published 2 years ago. We have here more or less 2,000 women with a previous cesarean section, and some of them had a cesarean scar defect. Again, they found in a very consistent way with all previous published articles that the scar, the niche, is associated to reduced live birth, and they could find a correlation existing between the dimension of the niche and the risk of miscarriage. The larger the niche, the lower, in the end, the live birth rate. We have submitted this article very recently in which we found that the dimension of the niche is changing across the menstrual cycle. You see here in the left side, you have the niche during the proliferative phase, and on the right side, you have the same woman, the same niche during the secretory phase. So that's important. I mean, if the dimension of the niche, you think this may be important for prognostication or for deciding whether or not to operate a woman, please take this into account. So we need to standardize the phase of the cycle in which the dimensions of the niche must be taken. Why women with CSD are less fertile? First of all, because the niche, we said, is associated to some gynecological symptoms, which of course may change sexual behavior, may decrease the frequency of sexual intercourse. Most importantly, the niche will lead to accumulation of blood and fluid within the uterine cavity. This is very, very important, especially at the time of the embryo transfer. But also, we heard this morning regarding the relevance of hemoglobin and the iron, and that the activity of iron as a pro-inflammatory agent. So this is true for the cesarean scare defect too. The iron may increase the acceleration of lipid peroxidation. It may activate macrophages, and in the end, this has been associated to reduced sperm function. But also, it has been reported some abnormality in immunobiology, in angiogenesis, and into the modification of microbiome, and we know how much important are all those aspects when talking about human reproduction. Very recently, some group of authors have reported a different, an abnormal contractility, abnormal subendometrial contractility in women with the niche, and this has been linked to the possibility of dysmenorrhea and, again, reduced implantation rate. Finally, for those of us who are performing the embryo transfer, sometimes you have large niche which in combination to a fixed and retroflexed uterus, sometimes this may impair accessibility to the uterine cavity. And we know how much important is the quality of the embryo transfer procedure in inducing success after IVF. So we have a problem. The problem is the niche. We have many women with the niche, and many of them require and they want a second pregnancy. So, of course, this is not a medical problem. This is a surgical problem. And at least to my knowledge, it can only be solved by surgery. Then you can decide what kind of surgery. And we have here a publication by Dispiezio, who said if the residual myometrial thickness is of at least 3 millimeters, then you can move with you can propose hysteroscopy. On the contrary, you may propose some other approaches for other cases. But the point here is, have we ever asked ourselves how much are we able to restore fertility after surgery? Well, again, I went across the literature and I found something which, however, is not so consistent. I mean, we have here this meta-analysis published in 2021, including 13 studies, 6 case series, 6 retrospective studies, and just one small randomized control trial, which, believe me, has been published on a very, very low impact journal. So for a total of 234 women, and in the end, the pregnancy rate after surgery and during the study period was 65%. And then in the last 2 years, we have a couple of studies. The best one is probably this prospective study published in 2023, including 191 patients, and those patients, they had a pregnancy rate of 47% after 1 year. You should know that the rate of fertility within the general population is 90% after 12 months. So my perception is that probably even if we perform surgery, probably the fertility of those women is not restored totally. So, dear colleagues, let me conclude with a few take-home messages. Almost 40% of women with a previous C-section may have a cesarean scar defect. The risk of CSD increases with increasing number of C-sections. In large population studies, the possibility of a subsequent birth is decreased by 10% in women with a previous C-section, and it is controversial whether women with a previous C-section may have a lower chance of live birth after IVF when compared to women with a previous vaginal delivery. The problem is the CSD, and in case of CSD, in IVF, there is an increased risk of miscarriage, and the live birth rate is halved from 30 to 15% globally. Some studies have found a correlation between the dimension of the niche and the worsening outcome of IVF. The prevalent clinical strategy is to propose the surgical correction for women with CSD and secondary infertility after the exclusion of all other causes. But we still need to know at what extent the future fertility will be improved by the surgery itself. Thank you very much for your attention.